I'm Nick Seco from HomeRight Windows and Doors, and we're located in Waynesboro, Pennsylvania. So we do vinyl replacement windows, we do steel and fiberglass entry doors, we do aluminum storm doors, and we do sliding patio doors, all made by Provia. The windows are a vinyl replacement window, and it could be anything from double hungs to casements to bay and bow windows and everything in between. So when somebody calls in the office and needs an estimate, they get Roxanne on the phone typically, and she would schedule an appointment for me to come out and take some measurements, provide some literature, go through what options we have, and then I would follow up within about 24 to 48 hours with an estimate with all the details of the products as well as the installed price. I find that we're typically much more affordable than the companies that you see advertising on TV or in a lot of other places. If they're spending a lot of advertising dollars, obviously they're passing those costs on to their consumers. You could go to our website at homerightwaynesboro.com, or you could call us at 717-749-4874.
Local and live, covering Franklin and Washington counties, it's Let's Talk TriState with Tiny and Katie.
Welcome back to Let's Talk TriState, all powered by HomeRight Windows and Doors, the right choice winner in the 2024 Best of the TriState. Our next guest today, this is actually quite a privilege for me, and because this is somebody that I know personally. We have Dr. Choudari. He's the medical director of Meritus Hagerstown Gastroenterology, and personally, my GI doctor as well, who I've been seeing for the last 15 years. So it's so good to see your face, Dr. Choudari.
Thank you.
And so for anyone who maybe isn't familiar, let's just start. What is a GI doctor? What is it that you specialize in?
A gastroenterologist is a physician who looks after the GI tract, the esophagus, stomach, small bowel, and colon. In addition, we also take care of the gallbladder, the liver, the pancreas, the spleen. So anything below your diaphragm and above your pelvis.
And I know we wanted to really focus on the importance of colon cancer screening, because I think maybe that's sometimes something that people don't keep top of mind. But why is it so important to do a colon cancer screening?
Well, colon cancer is the third leading cause of cancer-related deaths in men and the fourth in women. The lifetime risk of developing colon cancer is 1 in 24 in men and 1 in 26 in women. However, each person's risk may be higher or lower depending on their risk factors for colorectal cancer. March is actually Colon Cancer Awareness Month, and it's a timely reminder to get screened for one of the deadliest but most preventable cancers available.
Now, to do a screening, is that different from a colonoscopy, or is that the best way to screen for colon cancer?
Well, colonoscopy is by far the gold standard. And there are a number of reasons for that. What happens during a colonoscopy is a long flexible tube is inserted into the rectum. You've got a video camera at the tip of the scope, which allows the doctor to visualize the colonic mucosa and identify polyps. Colonoscopy takes about 30 to 40 minutes, and screening is repeated every 10 years if nothing is found and you don't have a risk factor for colorectal cancer. People worry about the prep. The prep for colon cancer is no fun, but far from being awful. There are a number of preps available. I tend to use Miralax and Gatorade, which is a simple prep and much easier to take. Yes, you'll feel hungry during the prep, and you'll poop a lot. The procedure is done under anesthesia, and there is nothing painful about having a colonoscopy. The benefits, on the other hand, are easily quantifiable. The goal of screening is to identify and remove precancerous polyps that may develop into cancer. And if polyps are found early and removed, the risk of cancer is reduced. Colonoscopy clearly saves lives.
What is the age that is now recommended for colonoscopies? I think it's dropped a little bit, hasn't it?
It used to be 50. Now 45 is the new 50. Having said that, if a patient does not have any symptoms it's important to talk to your doctor about your family history. Because if you have a family history of colorectal cancer, the age you start screening might be even lower than 45.
And what would be something that would make you think that maybe you are having a symptom of cancer or something that's going on?
Yeah. I mean, generally, if you have a change in bowel habits or you have minor bleeding, and even if you think it's a hemorrhoid, you should get a colonoscopy.
And if you don't mind, Dr. Choudari, I can speak a little bit to the prep because I've been getting regular colonoscopies since I think my first one, I was 26 or 27. I was quite young. And it all started, I had what I thought my appendix had burst. And I went to the hospital and they determined that it was diverticulitis and pretty severe. And I had to get a colonoscopy. And then after that, it was recommended, you and I, sat down and kind of came up with the course of action that every 3 to 5 years I would come back and get a colonoscopy. So I've had quite a few now because I'm almost 40. And I would say even from the first one I had to the last one I had, which was probably a 10-year difference, the prep was so much easier than it was years ago. And I think you were right with what you said. People maybe are hesitant because of the prep, but the procedure itself is cake. There's nothing to it.
You're absolutely right. There are a number of preps, commercial preps available, and there are even pills people can take if you can't take the prep.
And I think that, what did you say? The whole procedure maybe takes 30 minutes, if that?
That is correct. 30 to 40 minutes. Yep.
And one of the things I actually found beneficial is you do have to fast. Obviously, there's nothing in your system by the time you get the colonoscopy and you are hungry, but that's an excuse then to eat whatever meal maybe you want when you're finished.
Absolutely. Yeah.
And so what other advice would you give to people, Dr. Choudari, who are on the fence about colonoscopies or are thinking, I think this might be something I want to do, but I'm still really hesitant about it?
There are other screening tests available, and any screening test is better than no cancer screening test. There are stool tests available. I'm not a big fan of them, but they are available. And one of the common ones people use is a stool DNA test called the Cologuard test. The stool DNA test uses a sample of the stool to look for DNA in the cells, which might indicate the presence of colon cancer. For this test, you collect a stool sample at home and send it to the lab, and they get you back a result in a few days. The stool DNA test is done every 3 years. The problem with this test is there's a lot of false positives and false negatives. To put it into perspective, 1 in 6 patients will have a positive Cologuard test. Cologuard test fails to detect cancer in 1 in every 13 patients. Whereas colonoscopy can detect about 95% of patients with advanced polyps or advanced adenomas, the Cologuard detects it only in 42%. And Cologuard should not be used. Any of the stool tests should not be used if you have a personal history of colon cancer or polyps or a family history of colon cancer. The bottom line is the stool test or Cologuard is not colonoscopy. And the simple reason is the stool test or Cologuard is designed to detect cancer, not prevent it. When you do have a test such as colonoscopy, which can detect precancerous polyps before they become malignant, why would we use an inferior test when you can detect the polyps before they become malignant? So colonoscopy clearly is the gold standard.
Is there anything else that a colonoscopy can detect outside of just cancerous cells? Anything else that maybe the colonoscopy will pick up that could then eventually be a problem later on in life that's not colon cancer, like diverticulitis?
We do colonoscopy for a variety of indications, not only screening for colon cancer, but people have diarrhea, people have bleeding, people have constipation, people have abdominal pain. I mean, you can make a diagnosis of colitis, of inflammatory bowel disease, Crohn's disease, ulcerative colitis, microscopic colitis, the bunch of other diseases one can diagnose with colonoscopy and biopsy.
What is colitis exactly?
Colitis is inflammation of the colon. And that could be due to a variety of reasons. The commonest things we talk about is inflammatory bowel disease, and we talk about Crohn's disease or ulcerative colitis. There are other forms of colitis. It could be drug-induced colitis, could be microscopic colitis, which is collagenous colitis, or lymphocytic colitis. So there are numerous forms of colitis. Yeah.
Let's go back. Go ahead.
Sorry, that's a histological diagnosis. So we send the specimens to the lab, we get back a diagnosis, and then plan management.
And I don't think people understand, maybe just don't know that there are so many other things that colonoscopies detect and look for just outside of cancer. I mean, I know for me personally, the colonoscopies I've had, obviously that's something that, you're checking for as well, but it's not specifically for that. That's not why I have to go and get my colonoscopies. But it's also good to know, just for your own sake of mind, that everything is in working order and good to go, because that's not an area that's fun to deal with when something is not going well.
Yeah.
And I do want to go back to the colon cancer for a second, because I think that colon cancer was a disease that people kind of thought, oh, this isn't going to happen to me because I'm so young. Are you finding that colon cancer is something that is happening at a younger age? And if so, do you know why?
I'm glad you brought this point up. Early onset colon cancer, by which I mean colon cancer diagnosed before the age of 50 years, is rapidly on the rise. Early onset colon cancer now accounts for nearly 10% of all colon cancer patients. Since 1994, cases of colorectal cancer in young patients have increased more than 50%. Researchers now tell us that in the next decade, it is estimated that 25% of rectal cancers and 10 to 12% of all colon cancers will be diagnosed in people younger than 50 years of age.
Wow.
The important thing to remember is patients with early onset colorectal cancer typically are diagnosed with more advanced disease, which is associated with increased incidence of morbidity and mortality. And I think the important thing is one should be aware of your symptoms and what they represent. I see patients all the time who've had symptoms for months, years before seeking medical attention. And you raise an important point. Why is this happening in younger people? I think researchers really don't know the answer for that. People have speculated on sedentary lifestyle, obesity, smoking, low fiber and high fat diet, environmental factors. Nothing's been clearly implicated. I don't think there's going to be one smoking gun which explains everything, but it's probably a combination of a bunch of factors.
Do you think, and this is just me speculating, but there are so many fad diets out there that are, I feel every week there's something new. There's keto or the carnivore diet or this kind of diet or that kind of diet. Do you think that could also be a factor? And younger people are trying these diets out, and there's probably not as much research done.
Absolutely. Typically we talk of advise patients to eat a plant-based diet, low fiber, and limit your red meat.
Okay. And Dr. Choudari, are you taking new patients?
Absolutely.
Okay. And if somebody, hopefully, I'm very happy that I was the one that was able to do this interview, because I know you are my GI doctor, and I know people, it's uncomfortable to talk about these types of things. And especially if there's a change in your bowel movements, nobody wants to talk about that. But you have no idea what the underlying cause could actually be. And so colonoscopies are so important, and they're so easy. The prep stinks. It does. But the procedure is nothing.
Absolutely. You're going to be put to sleep. You're not going to, and Meritus is making it easier for patients. Meritus recently opened a new surgical center. It's called the CP Choudari Surgical Center, and it provides patients a more affordable, convenient, and personalized alternative to the hospital for the endoscopic procedures. The center is more intimate than the hospital and gives patients a greater sense of personalized care and contact with their care team.
And I don't know if everybody realizes that you are asleep when the actual procedure happens. So you take a nice little snooze, you wake up, and then, once you can eat, you have a good meal. And then, and I know the last time I went, there were pictures. So instead of trying to explain it, there's actually pictures that you can look at so you can see this is a polyp, this is this, because it's hard to visualize, obviously, unless you're a doctor, what exactly is going on in there.
That's absolutely correct. Yep.
And so, Dr. Choudari, how can people reach you in your office to schedule colonoscopies, or just if they wanted to get more information?
Oh yeah. I mean, they can call our office, talk to my staff, talk to my nurses, and we'll be happy to see them and set up their colonoscopies. And
you know who else is going to be calling you to set up their colonoscopy? That will be me. I'm due. And I can speak from experience. Dr. Choudari is wonderful, so kind and just patient and amazing. And you've always been so amazing with me. And so I can definitely speak to how great you are, how great your practice is, and how easy and important colonoscopies are.
Thank you very much.
Thank you, Dr. Choudari. Thank you for spending time with us today on Let's Talk Tri-State. We really appreciate you.
Thank you.
If you'd like to be featured on an upcoming episode of Let's Talk Tri-State, call 717-597-9200 or email letstalk@921thegoat.com.